Good day, everyone. My name is Captain Dave Clement, and I am a public health trainer here at the Social Safety Initiative. And so we are a nonprofit volunteer organization that specializes in pre-incident education and social hygiene training. We have 75 years of public health experience, whether that be in microbiology, biology, public safety, genomics, and a wide range of public health specialties. So today, we're going to equip you with education and information to help you through this era of COVID-19 and help you avoid transmission of these aerosolized viruses. So without further ado, let's begin. Alrighty, our first term for today will be pre-incident education. Pre-incident education is a fairly easy term to figure out. It's essentially preparing for an incident before it happens. And so I'll kind of give you an example. I joined ROTC in my college career. ROTC is Reserve Officer Training Course. And during our 2-year tenure, we had to learn a variety of different things, including military history, marching, and leadership strategies to help us better prepare for our boot camp. And so much like pre-incident education, we utilize all that training that we gained from those 2 years to help us be successful for our field training or our boot camp experience. And much like, and how that may correlate to COVID-19 is essentially together by providing our communities vital critical scientific information about how to prevent the transmission of COVID-19, we can help reduce the spread of this aerosolized virus drastically. So our next term is social hygiene and how that pertains to social preparedness. So fairly easy terms, so we'll kind of go down the list. So hygiene. Hygiene is a series of individual practices we perform to preserve our health. And social hygiene is a collective practice of safety protocols we perform to preserve our community health. So two slightly different meanings. And so I'll kind of go into that with my example. And so during our field training or / boot camp experience, we had to prepare for our exercises. Much of the exercise varied, but for this case, we're going to be discussing IEDs, which is improvised explosive devices. And so you would have a team of 4 members, and so each member would be provided guidance on what to do specifically. So individual practices, right? Individual practices to preserve our individual health. So for instance, I had to ensure that I read the protocols and monitored my side of the vehicle. And so let's connect that to social hygiene. Social hygiene in this case is we had all those groups of individuals, we collectively ensured that the spacing for the area to check the improvised explosive device was clear. We had to read our protocols to make sure that the bomb squad could safely go to the explosive device and dismantle it. And so essentially we had to work as a team to ensure that everybody as a community would essentially do well in this exercise. And so how that correlates with COVID-19 is that we have various protocols that we need to follow to ensure that our community is safe and protected. And so we'll go into more details of that in the coming slides. All right, so you'll be given two guidebooks after this wonderful training that we're going to be providing to you. So the first guidebook, of course, is cleaning in the era of COVID-19 and beyond. So what does that mean? Many of you are probably wondering, how often should I clean? What disinfectant should I use? is this disinfectant too strong? There's a lot of implications to what to use and how to use it, right? And let's also not forget that there's also some health implications. Some people may be impacted by certain disinfectants, thus increasing risk of asthma and other health implications followed on. So this guidebook will provide you an in-depth, detailed experience of what you need to know in terms of cleaning and disinfecting and so on. So please feel free to dive in there and learn as much as you can about cleaning and making sure your environment is safe within this COVID-19 era. Our second guidebook that we'll be giving you today is a guidebook of practicing public health protocols in the era of COVID-19. So as you can see to the side there's about 8 protocols that you can follow on, much of which we'll be discussing in this training today. But this guidebook goes into in-depth discussion about furthermore about the protocols that will be very, very good for you to know. So please, please, please get your guidebooks, use them, pass them on, and definitely help in this gaining of knowledge to help guide us through COVID-19. Alrighty, so we're about to watch a wonderful video called Covella versus the World. This video in itself is a partnership with Las Vegas performing artists and Social Safety Initiative. And so it's identifying a villain, which is Covella, hint, hint, it's COVID, and the world, which is our hero, or our hero, the world, will have to face Covella and try to implement various protocols to ensure that Covella is defeated. And so without further ado, let's jump into the video and let you guys see it for yourselves, and then we'll go into an after action discussion about it. So we just finished watching a wonderful film with Covella versus the World. And as you saw, Covella and her minion went into the restaurant and the bar enclosed area. And as you saw, the minion was pulling people together, reduce the space, and increasing the shared air that a lot of the people were in. But our great hero, the world, noticed all of these things and incorporated the protocols that he needed to in order to help ensure the safety of the community by spacing out people, making sure that their masks were on, and eventually, as you saw in the ending, utilizing some awesome movements to and of course some sprays, ventilation systems, and all sorts of unique performing artist styles to help defeat Covella. So much like the world and utilizing protocols and ensuring everybody's safety, this is what we want you to do. And so we'll go into more deeper discussions about, first and foremost, what to do. And so without further ado, let's get into it. But before we get there, we need to learn what to know, right? So what should we know about COVID-19? First and foremost, we're going to get you these three terms here: viral load, shared air, and exposure to it. So what is viral load? So it's essentially the level of amount or number of virus within the room, surface, or on the body, right? What is shared air? Shared air is when whatever is being exposed from the mouth from an organism to others, right? And so whatever is being spit while you're talking, just splattered while you're maybe coughing, like, and so particles, right, are just composed within this airspace, and then also sprayed. So you sneeze and a whole bunch of particles can just spread within minutes. And then our third term is exposure time. So CDC notes that 15 minutes is more than enough time for a person with COVID-19 to infect a group of folks or another person within close proximity. So when you combine all of that and you refer back to the presentation of Covella versus the world, as you saw in the bar, people were close in together, and you saw how they were increasing the level of shared airspace because they're in close proximity, right? And if they're infected with that virus, their viral load and that shared airspace is increasing that risk. And then obviously, if you're in a bar for a reasonable time, that exposure time, that 15-minute period is going to dissipate, right? And so it's imperative that you keep that in mind when you're first doing your assessments. You've got to make sure that you understand that you want to reduce, right, the level of viral load. You want to reduce the level of shared air, that shared space, and of course the level of exposure time you have within an environment. So I want us to all go into a very unique activity. This is called a risk assessment activity. So I want you to look at these pictures right here and identify some of the hot zones. And for those of you who aren't familiar with hot zones is specifically anything, any space that is at risk of infection or transmission of infection of aerosolized viruses. So I'll give you about 20 seconds to look at these images and see where you would find a hot zone associated with increased risk of COVID-19. So we'll start the timer now. Alrighty. So jumping into the hot zones, I circled left to right some of the hot zones that we particularly will be focused on today. So starting from left to right, essentially we have those two individuals. Why would this be considered a hot zone? First and foremost, neither of them are wearing masks. They are not, and we'll assume that they're not following the 6 feet distance space. Therefore, that spit, that splatter, and that spray is increased among both of them. And that shared air space that they're having also increases their chances of getting COVID-19. Moving on to the right, you see that the window is closed. So by not increasing that level of ventilation, you're leaving all that excess particles to just float around in the air, thus increasing the risk of transmission. And the same, and we'll jump onto the time right there. The time is to highlight that 15-minute span. If you're standing there with no mask, not following the 6 feet guidelines, and you're there for more than 15 minutes, you're increasing your risk. And therefore, this is considered, these spaces, these enclosed spaces are considered a hot zone, right? So let's take a look at that. Again, it's simply closed space, no mask, no ventilation, and people are talking with each other interpersonally. Therefore, these places would be considered a hot zone. So moving on, we'll go on to the bottom left. And so you're like probably wondering, wow, I didn't consider outside being a hot zone. Well, if you're in close proximity and you don't have a mask, even if you're outside, you still have the chance of spit, splatter, and spray onto individuals, and therefore increasing that risk of contracting COVID-19. And that goes the same for the bottom right. So again, by walking in spaces without a mask and increasing that shared airspace and increasing that exposure time, you're placing yourself and others at risk. So it's important to identify these specific hot zones early on. That way you can help prevent the transmission of this virus. Alrighty, so how do we prevent the transmission of these viruses? We're going to go through these protocols, and I'm kind of going to conjoin them together. But as you can see, hand washing and disinfectant. So how can we keep ourselves clean, right? Make sure to hand wash for almost 20 seconds, or for up to 20 seconds with some soap. If you do not have access to soap and some water, make sure to utilize hand sanitizer. 60% or higher is recommended. Utilize disinfectants to utilize disinfectants at your best capability, and of course utilize that guidebook that we provided to you and that we will be providing to you, that will give you a better in depth of what disinfectants to use and how to gauge all that. And so interpersonal. So how do we help reduce the transmission of the virus through interpersonal? So as interpersonal, we'll combine interpersonal and 6 feet, right? So interpersonal 6 feet, maintain that distance and ensure that you can utilize various nonverbal cues, like saying okay without saying anything, or saying hi or bye, or maybe even speaking in a different direction than other folks. And there are very different nonverbal cues that you can utilize. In the military, we say hello by saluting. I mean, that these are various nonverbal cues that reduce that conversation, reduce that space, that interpersonal space with others. And also, of course, maintaining that 6 feet distance. So, next thing is light source and ventilation. It's important to have natural light, because once you have natural light and ventilation, it will help. First and foremost, through ventilation, it will help push out the particles outside. And as you can see, the windows are open, and all those particles will slowly, build up outside. And if you have a stagnant kind of environment, it's also imperative to put box fans to help flow that air out, because it's recommended 5 to 6 air exchange within an enclosed space to ensure that particles don't stay about into the area. As you can see, the windows are open, the particles are above in that area, but it's light, right? And addition to this, masks and barriers. Masks are, it's mandatory. Ensure you have your mask on to reduce that shared air, reduce that viral load, and reduce that spit, that splatter, that spray that may increase the risk of passing on this virus to others. And of course, barriers. There's various barriers that you can utilize, whether it be the plastic ones or the hard barriers, any sorts of barriers that can help maintain that distance from you, sharing that air, sharing that viral load, and exposure time with someone is always good. All right, just to kind of compose this whole what protocols I went through and what should I do to help avoid the transmission of aerosolized viruses. We're going to run through this wonderful World Health Organization video to kind of recap everything that was noted.
The COVID-19 virus spreads mainly between people in close contact with each other. It spreads most easily in crowded settings, closed spaces with poor ventilation, or through prolonged contact with an infected person. This is because, as a person infected with the COVID-19 virus breathes, talks, coughs, or sneezes, liquid particles of various sizes are expelled into the air. Larger particles are called droplets. Smaller particles are called aerosols. You can contract the virus if infected particles come into contact with your eyes, nose, or mouth. Whether you are inside or outside, always maintain a physical distance of at least 1 meter from others. When you are in an enclosed or poorly ventilated space, the virus can spread more easily. In these conditions, aerosols can remain suspended in the air or travel farther than 1 meter. When you are inside, make sure to stay at least 1 meter from others. Wear a mask. Open a window to improve ventilation. And limit your time spent in these settings. To protect yourself and others, always follow these 6 precautions.
So we just ran through a full recap of what to do on how to avoid transmission of this aerosolized virus, COVID-19. Of course, implementing the 8 protocols, which include the 6 feet distance, the mask, ventilation, and a wide range of other protocols that you can incorporate, including vaccinations. Onto this slide, the 1918 to 1919 pandemic. This slide is very unique in that we were practicing public health even before we got to where we're at now. As you can see, keep the windows open. What does that mean? Ventilation, right? Open sneezers to be arrested. It's essentially, hey, you want to ensure that you don't spread the disease through that shared air, that viral load, right? And so anything that can cause the spread of that disease, at this point they were very strict, right? But now we've gotten to a point where essentially, as you look at this news article, this newspaper, you can see all the lessons that we've learned from the past and how we've incorporated that into our protocols for the future. Much of this relates to a lot of the protocols we use now, which includes that increased ventilation, because we know those particles are going to stay in the air, which includes making sure we have the mask, because we know if you don't, then the particles can be easily spread to another person, and other protocols as well. And so the benefit to this is that we've learned from this and we've improved upon our protocols. We've improved upon our sciences to help ensure that our communities is safe. And in addition to this is that modern medicine has increased to a level that we're still continuing growing, right? And so vaccine implementation has helped reduce virus spread on a massive scale. And so in addition to these protocols, in addition to vaccines, we've grown to a point where we're able to identify the problem and understand ways to help reduce the problem at a significant level. And it all starts from 1918 pandemics such as these. And yeah. Alrighty, so I want you to take a look at this CDC table graphs. It's I highlight some of the COVID-19 cases, hospitalization, and deaths associated with COVID-19. And so it creates these groups where it's based on your age and essentially separates it from not vaccinated to fully vaccinated. And so the unique thing about this graph is that, as you can see from the graph, is that those who are not fully vaccinated are at higher risk of getting COVID-19. And so what that means is essentially that if you aren't able to get the vaccine, you have to employ more of these protocols to ensure that you're safe. For instance, let's do an activity. I'll start first. Look at yourself in this age category and see where you vector to. For instance, I'm in the 18 to 19 category. Or 18 to 49, I'm sorry, category. And so I am fully vaccinated. Therefore, I have a 3% chance of getting COVID-19. And so in terms of hospitalization for this group, since I'm fully vaccinated, I have a 3% chance of going to the hospital. And the same group, if I'm fully vaccinated, I have a 1% chance of death associated with it. And so these are very important data points to outline, because our medical technology has increased drastically, and vaccines have been very beneficial to helping us combat viruses and other diseases throughout history. And so what's important about this is that for instance, a family friend of mine, he was in the range of 15 to 49. Unfortunately, they were not vaccinated. And so that places them at a 97% chance of getting COVID-19. And if we think about the hospitalization and how that impacts, they're placed at a 97% chance of being hospitalized. And then if we check at the other category of death, that's a 99% chance of death if you're not fully vaccinated within this substrata of age. So again, it is imperative to utilize modern technologies, capabilities such as vaccines. But we also do note that there is also a substrata group that cannot take the vaccines because they're immune compromised and other health implications. And so for those who cannot, be sure to talk to your physician on other methods. But in the meantime, it's imperative that you utilize the public health protocols that we discussed to help ensure that you are safe and others around you are safe as well. And then at the end of the day, vaccines are body armor. So it's important to know that. But please do understand that this graph is simply here to outline those differences. So moving on to this, I want you all to take a quick second to look at this picture. And let's think about this for a second, because there was a point in time where we didn't know much about this virus. There was a point in time where there were people struggling to get into the hospitals because there wasn't enough ventilators for everyone. There was a point in time where deaths were exceeding extreme rates, and family members weren't able to get in touch with each other, get close to each other because of this aerosolized virus, COVID-19. So we've gone through a lot, but we've also learned a lot about the virus. We learned how to combat it. We learned what to do to help keep our community safe. And through all that, we learned that as a community, we have to come together, implement those protocols, implement taking vaccines if possible, to ensure that we can get through this together. At the end of the day, we know what to do against this virus, and we know what to implement. And so at the end of the day, it's imperative that we utilize all the resources that we can so that we don't end up back where we were with an even worse scenario. So it's important that when we think about our community, we think about others, that we look back to the past and see where we were and where we're at now, and how eventually, once we all incorporate these protocols, we take our vaccines if we can get through this together. Wow, so that was probably a lot to take in, but you all just went through a public health boot camp training, except you weren't yelled at, and I tried to make sure it was fun for each and every one of you. And so this is your call to action. This is your call to action to go ahead and take our public health safety test and then earn yourself a certificate so that you can help promote the importance of pre-incident education, social hygiene training. So please, please, please take your test, get certified, and spread the wonderful knowledge that you gain through this training. So to conclude, we talked about so much, but let's run through it all once more. We learned what to know, which is the virus, and how the virus travels and how it affects you in the terms like viral load, shared air, and exposure time, right? We learned what to do, which was the risk assessment, identifying those hot zones, and ensuring that we know what we should do in case that we're increasing those risks of transmitting those viruses. And of course, we learned how to avoid transmission through our 8 protocols and various videos associated with it. So let us spread the word and not the virus, and let us erase this contagion with education. My name is Captain Dave Clement, and I'm a public health trainer with the Social Safety Initiative, and together we will be okay.